I want to talk about something which really, really seems to stress people, everybody who hears the stories about the PPE VIP lane. Well, and pandemic profiteering, as it has been described, it is just unbelievable that people did this. Now, I want to put this into context because we're not just going to talk about the VIP lane. We're also going to talk about the numbers which the government keep telling us that they are investing in the NHS. And we're going to be talking to Dr. Dan Goyle, who's got some statistics with us, because there's a little bit of possible fudging of the numbers. But I'm going to go back to what's called the Public Accounts Committee. Now, this is a committee, obviously, which sits within the Houses of Parliament. And it's run, the chair is Dame Meg Hillier, who's a Labour Member of Parliament. And she's been chair for a while. And they come out, I have to put my hand up here, I enjoy reading a Public Accounts Committee report because they look at detail, they look at contracts, they look at the data, and then they analyse it in a very calm manner. But a lot of their reports, which they have put out over the last 2 years, are quite shocking. So there was one which came out earlier this year, which said that in the 2 years before Boris Johnson became, it's all about fraud, by the way, became Prime Minister, there was an estimated £5.5 billion of fraud and waste within government departments. 5.5 billion. In the following 2 years, when Rishi Sunak was Chancellor and Boris Johnson was Prime Minister, that quadrupled to an estimated £21 billion in fraud and waste on government departments. Now that's significant. In December, just gone, they came out with another report. And this was about what's called procurement, the amount of money which is spent on goods and services. So within a year, this was from April 2021, because it goes through the tax year effectively, to 2022, rather than the calendar year. The government spent £259 billion procuring goods and services on our behalf using tax that we have paid. But the committee report found that the government is unable to demonstrate that it is achieving value for money in public procurement due to significant issues with the quality and completeness of data on contracts. For instance, more recently, there's a brilliant investigative journalist called Russell Scott, and he's been looking at the Palantir contract for what is effectively the handing over of all of our NHS patient data to this American company run by Peter Thiel, who has just secured a £330 million NHS data contract. And when the founder of Palantir was discussing the health service back in January, he said this: highways create traffic jams, welfare creates poverty, schools make people dumb, and the NHS makes people sick. And all our data is going there. Now, what Russell Scott found, bearing in mind what the Public Accounts Committee has said, he said the contract which this journalist found is so heavily redacted that nearly all the key points have been completely removed from view. The published contract has heavily redacted key sections such as the crucial information on protection of personal data. Sections on costs, services, spec, standards and suppliers have been redacted in their entirety. So this is what we're talking about, transparency. There was none with the PPE VIP lane. And this morning, Michelle Mone, you know all of the story that she sent an email, contacted Michael Gove, who passed on her recommendation of a company called PPE MedPro to the VIP lane. They were awarded 2 contracts, one of which was for £122 million for surgical gowns. all of which were unusable, and now they are being sued by the Department of Health. Michelle Mone lied for all of this time until a matter of weeks ago. You've seen it all. It was a lead item on the television, and so on, being interviewed by the BBC. She lied to the press. They threatened the press. She lied to her lawyers, and then she lied about her lawyers when she said, "I was told to lie. They told me to lie." Anyway, this morning they've issued another statement, this time from her husband, Doug Vorderman, which is what I described as a look over there statement. Don't look at us. And it basically says, we weren't the only ones. It's not fair picking on us. That's all you need to know. And in it, a rather bizarre claim that they saved the government £100 million. Yet another lie. They didn't. I am well up on VIP lane contracts. The price of their unusable gown, let's remember it was unusable, was slightly less than the average price for PPE surgical gowns across all contracts given, not just in the VIP lane at that time. So it's a scandal. It's an absolute scandal. Also, I should point out that the tax lawyer hero, Dan Needle, who fundamentally brought down Nadeem Zahawi, has calculated this morning that because Doug Vorderman lives and is registered in the Isle of Man, his tax regime is completely different. Had he registered the approximation of £65 million so-called profit as dividend from the company, he would have had to have handed over to HMRC here £24 million because he's in the Isle of Man. It's basically nothing. Yeah. So they swipe it one way and they swipe it another. Anyway, that is all to be discussed. There is a civil case going on, and there is a criminal investigation as well. Do you know what? If I was on Mastermind, Celebrity Mastermind, it would be my specialist subject. Or should I say, Who Wants to Be a Millionaire? Right. 6 months ago, keep your calls coming in, by the way. I want you to ring in on 0345 6060 973. Lots to discuss. But before we go to the lines, 6 months ago, Rishi Sunak claimed this.
Already we've made progress, with more investment in the NHS than any government before, including up to £14 billion extra for health and social care over the next 2 years.
The Prime Minister was speaking at the launch of a 15-year plan for new medical professionals. Sunak promised in his speech £2.4 billion over 5 years to hire and train NHS staff, claiming his government has invested more in the National Health Service than any other previous government. Is that really the case? Well, we're joined now by Dr. Dan Goyle, Health Policy Editor for Byline Scotland. He's also an NHS medical consultant. Hi, Dan. Lovely to speak to you.
Hi, Carol. Delighted to speak to you. Happy New Year.
And a happy Hogmanay to you.
Thank you very much.
Up there. Now, Dan, we hear all these numbers given out, and this is about a trust, really, about a trust in government, about a trust in what they're telling us. Can you tell me, specifically within the NHS budget, first of all, because I was just talking about the PPE, was the test and trace £37 billion and all of this money for the PPE through the VIP lane, has that been included in the numbers the Tories give us for the NHS spend?
That's correct. That is correct. It's not difficult to find. It's in the NHS annual report. It's I think over the 2020, 2021 and 2022, there was 86 billion added to the NHS budget. Of that, as far as we can see from the annual report, about 17 billion of that was used directly by the NHS. The question is what's happened to the other...
70 billion is still under question.
70 billion, yes, right, Carol.
So
sorry,
87,
I'm not going to question your numbers, Carol.
Yeah, no, don't question my numbers. So 87 billion was added to the budget.
That's right.
17 billion is kind of accounted for and has been used. So 70 billion.
Yeah. So 70 billion that we don't know exactly who got the contracts. As you say, the contracts are a bit murky. But when you hear of a PPE scandal like the Mone one, there's very, very many more. All those numbers you're hearing were numbers added to the NHS budget. So Mone's contract was added first to the NHS budget. We didn't see any of it. They then gave the money to MedPro.
Yeah.
And they've got the PPE in. Now, arguably, we benefited to some degree from the PPE.
Well,
unusable
the stuff
PPE.
that was usable.
Exactly.
Dan.
Exactly. And it wasn't even the right PPE. I mean, this PPE was cheap. It was the very basic stuff. One assumes probably because it's got quite a high markup on it.
Yeah.
What we needed with the FFP2s, we needed proper respirators, proper gowns, which we didn't get. And the big question for me, Carol, was there a delay in us getting PPE so that these companies could be set up and acquire the PPE? Because on the face of it, it looks like there was a delay and we were in substandard or not in any PPE at all, purely for these other companies to try and get their pipeline of PPE in place.
Well,
when we had other companies.
Yeah, well, as I'm sure you were about to go on and say, which is that there were, some excellent NHS suppliers, one based in this country that had, I think, over 1,500 employees. They made the PPE here, and they were rejected, even though they were constant suppliers to the NHS. Yeah. And on the VIP lane, anything that went through there were 50 companies which received one or more than one contract. They had a 10 times more chance of receiving the contract, 10 times more chance than all of these wonderful companies whose business it was to provide PPE. The vast majority, if not all, actually, of those that went through the VIP lane, like you say, it is absolutely not transparent. I mean, a lot of the information that I have found through working with the Good Law Project and Byline, which is excellent journalism, has been found through this murky thing. And it's quite astonishing when they are companies that had nothing to do with PPE, literally nothing.
Yeah, literally set
nothing.
up a week before, and no expertise. I mean, effectively creating a middleman situation, and the profits were mind-boggling. I mean, 30%, 50% profit. And this is your countrymen, our country people are actually facing this pandemic. We're all scared. We're all afraid. And your first thought is, how can I cream 30% more profit off it? I mean, this was a time for these wealthy people to stand up and say, you know what, we're going to help you. We're going to chip in. We're going to, maybe make enough profit to allow the company to exist, but not extort the public purse. And this was actually money that the government were allowed to create based on the Coronavirus Act. So they were able to print this money effectively for COVID. And what it looks like to me, Carol, feeding frenzy. Yeah. This was here's all this new money. Everybody's those connected with the government diving in to try and get these contracts. Meanwhile, we're stuck at home, a lot of people on their own, people in wards terrified. I remember it was a scary time. And we didn't really thinking about money. We're thinking about, can I, protect my family? Can I protect my grandmother, my mum? We're terrified at this point, and they are searching for these big profits. And I think the public are right to be furious.
Yeah.
And it's inconceivable that this type of behaviour didn't cost lives.
And that's
I think it's inconceivable.
So we're saying here that of the extra money which was added to the NHS budget, which of course now they go, oh yes, we've spent more in our Parliament. I mean, it's a mockery. So I think the budget is around about 180 billion.
The total budget.
Total
the
budget,
core
yeah. Total
core
budget.
budget's less,
So, but of that 87, 70 billion in effect still isn't accounted for. And I was talking to the junior doctors at BMA a couple of days ago, and even which I don't think they'll get, the junior doctors got the pay award which they're after. That would be net 1 billion.
Yes,
net.
Exactly. Exactly.
This is, it's extraordinary.
And you're talking that's life and death stuff, Carol. So if you've got, you've wasted all those billions on PPE, and you had instead created those billions and just either restored pay, expanded bed capacity in the NHS,
given nurses their pay rise as they deserved.
Just let them break even
without having to strike. All of that.
You would have saved lives, a lot of lives. We're now running at 6% excess mortality. That I doubt very much would have been in play if we had put that money to directly to the front line. Yeah. So it's not a victimless crime. It's not just people getting rich. It's taking money away from the very people that need it.
And that's the essence of it, Dan. You're quite right to identify that. Dan, thank you so much. And hope to speak to you again. That was Dr. Dan Goyle, who's the health policy editor for Byline Scotland, which is an investigative news organisation.